కనపడట్లేదు నాకు అసలు. అది రైట్. వచ్చేసింది. స్టార్ట్ చేయాలి. Can you hear me? All of you. Any one of you, please respond. Yes, okay. All right. Today's topic is parental control drug delivery system. So we are going to discuss about the parental control drug delivery system here, and it includes introduction, routes of parental administration, biopharmaceutics of sustained release, controlled release, parental products, and different approaches for giving the parental administration of the drug, and some of the evaluation tests we are going to discuss today. Coming to the introduction of the parental drug delivery systems. So parenteral is nothing but it is other than the enteral route. There is nothing but other than the GIT route. We call it as parental drug delivery system. Either if you are giving that through intramuscular, or you are giving that through IV route, or through other any kind of subcutaneous or any other routes, then we call it as parenteral drug delivery system. Other than the enteral, means other than the GIT route, whatever may be the dosage from whatever may be the route of administration you are giving, that is called parenteral route of administration. Okay. So why we always prefer parenteral drug delivery system when compared to the other drug delivery systems? Parenteral drug delivery system offers a rapid onset of action when compared to the other drug delivery system, and we do have some other advantages when compared to the other oral drug delivery systems or some other drug delivery systems. You can see, I'll discuss it in the next slide. So here are the advantages. You can see we got a wide variety of advantages for the parenteral drug delivery systems. We can produce wide variety of drugs, can be formulated as parenteral drug delivery system. Most of the parenteral drug delivery systems are biocompatible with the vascular system, because whatever maybe you're producing some liposomes, neosomes, nanoparticles, which are actually the polymers which are indigenous in nature. So it will easily biocompatible with our indigenous cells. So this parenteral drug delivery system, most probably they are biocompatible with the vascular systems. Next, the possible biotransformation reactions encountered by several drugs offer oral administration can be minimized by this approach. See, if you see in case of oral drug delivery system, this dosage form, this will release the drug into the lumen, and that drug which is released into the lumen, that will be carried through this hepatic portal vein. This hepatic portal vein will carry the drug to the liver. There you will find the biotransformation of most of the drugs, because all type of cytochrome P450 enzymes are present in the liver, and these enzymes are responsible for first pass metabolism. Before entering into the systemic circulation, most of the drugs will get metabolized there, and that is nothing but first pass metabolism. You can see this first pass metabolism only when you administer the drug to GIT, that to the upper part of the GIT. And when you come to the parenteral drug delivery system, we can't see this first pass metabolism, because we are directly administering the dosage form into the systemic circulation. So we can avoid this kind of biotransformation reactions encountered by the several drugs which is administered through orally. Next, targeting of several drugs, particularly anti-neoplastic drugs, to the specific site and also to maintain desired therapeutic concentration is achieved. So in case of normal oral drug delivery systems and in another any drug delivery system, targeting to the several, targeting to a particular site, it is very difficult because absorption itself is a very difficult process in case of oral drug delivery system, and we do have lots of limiting steps while absorbing the drug into the systemic circulation. But in case of parenteral drug delivery system, we are directly targeting the administration of the drug to the targeted site directly, and we maintain the desired therapeutic concentration over there, and that will definitely decreases the toxic effects, or it may not cause any effects to the other sites of your body. Next, prolonged residence of certain drugs at a specific site can be made possible by using suitable parenteral approach. So prolonged residence of certain drugs. So most probably these drugs, usually when you give through oral, the drugs will distribute throughout the body, and then again it comes to the central compartment. From then it goes to the kidneys, and thereafter it goes to the external environment. But in case of parenteral drug delivery system, the drug will be administered directly to the site of administration, and then the drug will be entered into the central compartment if the concentration is high. But here, the dosage form itself, we are administering at the site of action, and this dosage form will release the drug very slowly. That too, in case of parenteral control drug delivery system, they will release the drug controlledly at the site of action, and that's why the concentration of the drug is maintained for longer time to give the longer therapeutic activity. So for chronic diseases, this is useful for especially for the chronic diseases and not for the acute ones. Acute ones, you need not to go for this kind of parenteral control drug delivery system. For chronic diseases, you can go for this parenteral control drug delivery systems. That will be very advantageous when compared to the other ones. Okay, biotransformation and excretion loss can be minimized so that the dose required for the parenteral administration can be reduced. So usually when you are preparing the control drug delivery system, most of the drug will be excreted through the feces. So some of the drug will be absorbed and some of the drug will be excreted through the feces. So this first pass metabolism also influences the dose. What is the size of the dose? It influences on the size of the dose, because when you give through oral drug delivery system, we have to consider this biotransformation and excretion of the drug through the feces. You have to include that dose as well, along with the concentration should be maintained in the systemic circulation, because this amount of the drug which is metabolized and which is excreted through the feces, this has to be considered, because every time if you are giving 100 mg of the drug, then 50 mg is excreted, then only 50 mg of the drug will be entering into the systemic circulation. So you need to consider these things while formulating the oral drug delivery system. But in case of parenteral drug delivery system, we can avoid all these things and the dose can be reduced. Directly, you can take the 50 mg of the drug and you can give it directly into the systemic circulation, so that we can reduce the dose, and that will make you more economical while producing the dosage forms. We can use this economical things in the formulating the highly sophisticated dosage forms. Okay. So transformation, maintaining therapeutic concentration over a long period of time. So same thing I told you, maintaining therapeutic concentration over a long period of time, that is parenteral controlled dosage forms will maintain concentration for the longer time at the site of therapeutic activity is required. Next, disadvantage of this parenteral drug delivery system, especially these parenteral drug delivery systems, usually we use this by piercing the skin or piercing the tissue. So it is difficult for the patients, and that's why this limits to the patient complaints, where most of the patients don't accept this kind of parenteral drug delivery system. So patient complaints is one of the most problem in case of parenteral drug delivery system, and withdrawal of the dose is not possible. In case of oral drug delivery system, we can go for the withdrawal of the dose as whenever you are desired to be, whenever you're desired, you can go for the withdrawal of the dose, because if you're giving oral drug delivery system, if there is any side effects or you're getting some contraindications from that, then you can go for giving the, other drugs to, by producing diarrhea or by producing vomitings, we can easily withdraw the dose. And in case of other dosage forms like what do you say, transdermal patches. So these kind of dosage forms, dose withdrawal can be done very easily. But in case of parenteral drug system, once the dose is administered into the systemic circulation, it is very difficult to withdraw the dose. Not difficult, it is impossible actually to withdraw the dose. So self-administration is not possible. See, if you, I told about this eye drops and what is this? Transdermal patches, oral contraceptives, oral, what is this? Oral pills or oral tablets, everything. These things are self-administrable and it will be very comfortable for the patients without any personal skills to administer the dose into the systemic circulation. Next, administration requires strict adherence to aseptic procedure and some pain on injection. So that is what I told. We need some, when we have some pain when you are injecting the dosage form into the systemic circulation. And one more thing is, it requires a strict adherence to the aseptic procedures, because we are directly injecting the dosage form into the systemic circulation. It is very much dangerous if you are not following the aseptic procedures, because any microorganisms or any other things that will directly enter into the systemic circulation if you're not following any aseptic procedures. So virus or bacteria, if you're not maintaining the aseptic procedures while formulating the dosage form or while administering the dosage form into the systemic circulation, it what happens is these microorganisms will directly enter into the systemic circulation and they may cause serious effects to you. The manufacturing and packaging requirements are most expensive than preparations of given by other routes. So why I'm telling why this manufacturing and packaging of the parenteral drug delivery systems are more expensive when compared to the other dosage forms. What the thing is, we have to maintain the aseptic conditions, we have to maintain the particle size in the room, we have to maintain the we have to sanitize every time when you go out and in, and we have to maintain some dress code in that particular specified area, and specifications, maintenance of the particle size, airflow movement, and what do you say, aseptic conditions, everything. To maintain all these things, we need to organize the room in such a way that it should not produce any bacterial growth in that particular area. So we have to check it. So every time in manufacturing of this parenteral dosage form, aseptic conditions are very, very important. These are the good manufacturing practices to be followed while formulating the parenteral drug delivery systems. So now routes of administration. The major routes of parenteral administration include subcutaneous administration, intramuscular administration, intravenous administration, intraperitoneal administration. So you can see this diagram. Subcutaneous, it is just the injection is given to the subcutaneous tissue. It is just permitted up to subcutaneous tissue. And if you see the intravenous, so it is when it is given to the muscular tissue, it extends up to the muscular tissue where this vascular system is widely dispersed there. And in case of intramuscular, this is directly, it extends up to the muscular part, but it's nothing but this muscular part will be higher, nearer to the bones. So it extends much deeper when compared to the subcutaneous and intravascular systems. So subcutaneous routes. This subcutaneous route, it is poorly perfused with blood. You know, subcutaneous tissue, it is having some, it is some fatty tissue usually, and there you can see very less blood capillaries distributed over there, and limited to the drugs that are not irritating, water soluble, and well absorbed. So this subcutaneous tissues, I mean, administration of the drug through the subcutaneous tissue, it requires some properties like it should be non-irritant and it should be water soluble, and it has to be absorbed easily through this